Morning. Welcome to First United Methodist Church. We're glad that you're here, and we are honored to be hosting you this morning and partnering with the Texas Interfaith Center for Public Policy as we begin this Health Justice Sabbath. As a community of faith, we believe that God cares about the well-being of God's children, of God's creation. We believe that God desires health and wholeness for all people in body and in mind and in spirit, regardless of their age and their employment and their income. Here at First Church, just like in a lot of faith communities, we keep a prayer list of those who are sick and hurting, both within our congregation and beyond it. And together we name those names out loud and silently in our hearts and in our minds, praying to God to intervene in difficult situations. This weekend, we add to our prayer list the lawmakers who have the power to make a difference in the lives of the millions of Texans who lack reliable and affordable access to good health care. They lack access to the care and the medication that they need, not because it doesn't exist, not because the science hasn't come far enough, but rather because the gaps in coverage are too wide and they have fallen through the cracks. When millions of people are falling through the cracks, there is something wrong with policy. And so we believe it's time to put our prayers into action on this issue of health justice. We call on our policymakers to rise from the ash heap of partisan rhetoric, to break the chains of polarization, and to come together and find a solution for the sake of the people that they have been called to serve. This is what justice is really about. Finding ways for all of the different parts of the healthcare system to align for the common good. Reverend Jim Mayfield used to talk about justice as an engine or a machine that is working at its very best in optimal condition. Justice takes all of the parts, all of us, working together for the sake of all people. And so we begin by coming together, by standing together as faith leaders and congregations. We begin this morning calling for the change that we believe is possible. Again, I welcome you to First United Methodist Church, and I thank each of you for using your voice in this call for justice. Now I want to introduce Ann Sapp, who is the president of the board for the Interfaith Center, Texas Interfaith Center for Public Policy. Welcome, Ann.
Good morning. I want to thank First United Methodist Church for hosting us. We really appreciate that. The Texas Interfaith Center for Public Policy is a faith-based 501c3 organization established in 2000. It provides public policy analysis to people of faith and other Texans. The center is the research and education partner of Texas Impact. Last summer, the discussion on healthcare has gone on forever, it seems. And we know that there's never enough, and we're always trying to fix it as Americans. There's been a lot of public, political discussion about who should get health care, how much people should pay for health care. But the truth of the matter is, we know, as representatives of the religious community, of the faith-based community, that all people deserve health care. That as people of faith, we know that it is our role to help others and to make sure that all people have access to health care. And so last summer, in talking with some of our faith-based leadership, we talked about the fact that there has to be a way to have these conversations outside of the political arena. That there are basic religious truths that don't change because of politics. And so we came up with the idea of doing the Health Justice Sabbath Day. And as a part of that initiative, we now have 100 congregations across the state who have instituted activities and who are working to remind their congregants, their communities, and often their political leadership that there is a reason that faith-based communities believe that people should have health care in order to survive. And so this initiative is kicking off this weekend, where churches are doing different, depending on their faith, they are doing different activities across the state of Texas. They're starting with, some are just doing prayer services, some are doing sermons, some are doing advocacy training. They're doing what fits their community and their faith. But we have 100 congregations who have signed up who said, we want to have this discussion outside the political arena, but we also want to inform the public and the political arena that healthcare is important for everybody. And so this press conference today, I want to thank everybody for coming. This press conference just highlights the Health Justice Sabbath. We have some speakers who are going to we're going to hear from the religious community, from the public sector, from the elected community, and from a person who is a cancer survivor who needs health care. And so we're going to introduce those people to you, listen carefully, take the message back to your churches, to your community, and make sure that Texas knows that there are people across the state of Texas who believe in God, who believe in a higher power, who believe that we should take care of people who cannot take care of themselves. First, I'd like to introduce Representative Donna Howard from Austin, who represents District 48.
Thanks very much. I had the good fortune to grow up in the loving, justice-seeking congregation of University Baptist Church here in Austin. And as an adult, I've had the good fortune to continue my faith journey as a member of First Unitarian Universalist Church of Austin. In addition, over many decades, I've been actively involved with the Interfaith community here in Austin through serving with what was then Austin Area Interreligious Ministries, now IACT. But all of those have informed my faith and what I bring as a legislator to the Capitol. I'm one of those who believes very strongly in separation of church and state, but that doesn't mean excluding the faith community from being a part of the solution. And I think that's what this is about today, is how does the faith community talk about and respond to what's going on? And, I can't help but reflect on what's just happened nationally and the uncertainty that we have surrounding what is going to happen to the delivery of health care in our country, but particularly here in Texas. I don't know that things are going to change a whole lot. I'm hoping they change for the better, but the fact is, regardless of what happens nationally, regardless of what happens with the Affordable Care Act, we still have a large number of Texans who do not have access to health care, who are not covered, who are deprived of getting the health care they need so that they can take care of their families and be productive citizens. I'm guided by faith traditions that recognize the interdependence and interconnectedness of all of us. The fact that what happens to one of us could happen to any of us, and that it all works together. We're all part of the same fabric here, and as some would say, we're all children of God. And that God has no grandchildren. So the fact is that we have some things that we can do, regardless of what goes on nationally. There are ways in Texas that we already work in a bipartisan fashion on a lot of issues. This can be one of those as well. This can be one of those where we do exactly what we tried to do a couple of sessions back, where we did have a strong bipartisan effort to come up with a Texas solution. We can do that again. And I think the faith community can play a large role in helping us recognize what are the steps we can take to move forward. What can we do to make sure that our neighbors all have access to the kind of health care they need for themselves and their families. And I also want to say that one of the concerns at the political level has to do with the rising costs of Medicaid, which is oftentimes a hindrance to us taking action, despite our bipartisan efforts to try to do so. My response to that, to my colleagues and to the faith community, which I think we can all work together on, is the best way to contain the Medicaid costs is to do all we can to help people out of poverty. Because the reason we have the growing Medicaid costs is because of a growing population that is in poverty. And I think more than anything else, the faith community stands poised and ready to do what I think most all faith traditions are called upon to do, and that is to help those, as we heard before, who cannot help themselves. So I see this as a very encouraging thing. I see this as an opportunity for all of us to come together and do our part. I'm very grateful for the faith community and what you do, and I think we can look at it in terms of not just one faith community or one way of experiencing faith, having say at the Capitol, but expanding that circle to mean that all of us, all faith traditions, all people of good faith who want to make this a better Texas, have a seat at the table. And I think this particular effort is going to be very important in setting that stage. So thank you very much for what you're doing.
Just one commercial. The Texas Interfaith Center has put together a lot of resources for churches, congregations, anyone, political officials as well, to use, which has information on health care in Texas, what the facts are, what some possible solutions are. You can find that information on our website, and it's abovepoliticstx.org. I'll say it one more time. abovepoliticstexastx.org. Okay. I'd like to introduce Reverend Billie Tweedie, who is from the Episcopal Church of the Resurrection. Thank you.
Well, thank you. It's an honor to be here today. I thought we were going to be sitting in a panel and having discussion back and forth. So I feel a little ill-prepared, but I'm so just grateful and glad to be here because something that is just kind of, as a pastor, I've been a priest for 7 years. I've served downtown at St. David's. I've worked at the Trinity Center across from Caritas, and I've seen people upon people upon people that have come through that have needed health care, have needed help in all sorts of levels, and you can't help but wonder, why can't they go and get more help? Like, how can they get more help? And as a church, we have limited resources, and we help out the best we can in the moment. We know that the church is also limited in our ability to really provide actual proper mental or physical health care. So I've seen firsthand, and kind of as a pastor, I've always just done my best to kind of either get them to the Trinity Center where there's a social worker and they can help them find health care. Now, I've moved parishes and I'm working out more in the suburbs, and I'm kind of confronted with a whole different level of issues out there where I don't see as much of our homeless neighbors coming through, but I do see the actual parishioners in my congregation. And when I go and speak with them and we end up talking sometimes about our greatest fears, so much of their greatest fears is not being able to have health care, not knowing how they're going to afford the medications. In fact, one woman who volunteers in our office every week and is so faithful and generous to the church, one day was in line at the pharmacy getting the medicine that the doctor said she needed, and she didn't have enough money for her medicines. And she just said, oh, I'm just not going to get that one, I guess. And someone else in the line had heard of this interaction and just paid for the medicine for her in that line. And she came back and told me that story, and it kind of brought me to tears. And I could see that it was so moving to her. And the thing was, she felt like she could have, she felt like I would have been okay without that medicine. And she said that because I know other people need that medicine more than I do. So the thing that I'm excited about this being a part of Health Justice Sabbath and getting Episcopal Church of the Resurrection connected on that level is because I think the parishioners there and myself, we want to know how to be more informed. We want to be able to help. I want to know how when I have the parishioner that lives across the street in low-income housing comes over and says, will you put my head in the road because I need a car just to run my face over because I'm done. Like, I don't have any way to get help. My teeth are all swollen. My face hurts so bad. And as a priest, I'm like, okay, I'm not going to stick your head in the road, but come into my office and talk. And I want to know how I can get more involved. I want to know how I can help. I want to know how I can channel people to go to the places they need to go to stand up so that they can live into those two great commandments that we get from God. I mean, my sermon to the children every week is just kind of going over the two greatest commandments, which is loving God and loving neighbor. And this just seems to be a really obvious time that we're not doing the best we can do to love our neighbors. And it's a time to come together and to figure out a way forward to make better plans and better plans of actions and to own the faith that we believe in. So I'm honored for the invitation to stand up here today. And I'm excited to find ways to get our communities more connected and be more informed. I think there's a real atrophy that has happened. As Christians, we inhabit two worlds. We know that we have our membership in the heavenly kingdom, and yet we stand here in this world and we see the brokenness around us, and we try to reconcile those two differences. And if we're not going to be really truthful about how broken things really are, it's pretty much impossible to reconcile those differences. So I'm really grateful for this organization that is bold and brave enough to put forward the true facts of how many people just do not have health care. And it's not just to say, oh my gosh, it's so bad, because it is, but it's also to say, let's go forward and let's live into the faith that we believe in. So thank you for the work and thank you for the time. And I look forward to being involved.
We at Texas Interfaith are hoping and planning that this initiative is not a one-time deal. This is a beginning. This is the beginning of relationships with the 100 and more congregations across the state of Texas. And as we go forward, one of the things that is most important is for us each to remember that we are talking about people. Sometimes when you talk policy, you forget that there are real people dealing with real problems. Niki Lawless has agreed to speak to us today and tell us about her experience with healthcare, health insurance, and what it means in her life. Thank you, Niki.
Hello, my name is Niki Lawless. I'm a veterinary technician here in Austin, and up until recently, I was a student at the University of Texas studying ecology. I want to thank the Texas Interfaith Center today and to the First United Methodist Church for having me so I could tell you a little bit about my story. I'm living with a rare type of bone cancer called periosteal osteosarcoma. I say living with because it's something that I live with and fight every single day. To fight this cancer, I'm currently taking over 100 pills a day, and I use this little thing right here to keep them all organized for me. It's a little crazy. I'm also currently participating in a clinical therapy, targeted therapy trial in San Diego that requires me to commute back and forth around every 3 weeks or so. I was first diagnosed with cancer at the age of 16 when I was living with my grandma in California. It only took the doctors 1.5 years worth of doctor's visits to realize that I had a large tumor growing on my left femur. It was a very hard time in my life because I was an athlete, and really the only option, or the only thing that they offered me, was amputation. Sarcomas are rare, and so is the research funding, which means not many options were available to me at the time. Thankfully, the doctor was able to perform limb-sparing surgeries, and after 3 surgeries in total and months of physical therapy, I could finally walk again. After recovery, I moved to Texas to get on with my life as best as I could. Unfortunately, I could not continue to check up with my checkups to monitor my bones and my lungs for metastasis. It was too expensive for me to see a doctor, and my pre-existing condition made it impossible for me to get insurance. A decade later, when I was a UT student studying abroad in Australia, I got sick. I just decided to wait to see a doctor in Thailand at an internationally recognized hospital since I was planning on a summer vacation there and the costs were much cheaper. A chest x-ray revealed that I had a large tumor in my lung. After returning to Australia and seeing many doctors, I was told that there was nothing that they could do for me. I was forced to return to the United States. But thankfully, Obamacare had just been created while I was abroad. I was enrolled on the last day of open enrollment and was finally able to have health insurance. One of my best friends arranged for me to have charity care surgery at St. Luke's in Houston while I waited to be seen by a specialist at MD Anderson, where I was referred due to the rarity of my cancer. After receiving 6 months of inpatient chemotherapy, I was declared NED, which means no evidence of disease. After 7 months, however, I relapsed and was forced to undergo 4 more months of inpatient chemo. During this time, my friend raised thousands of dollars for me, for my bills and for my medical care because I was too sick to take care of myself. As I was ending my failed chemotherapy in November last year, I was offered my best hope so far, a clinical therapy immunotherapy trial at MD Anderson. During that time, while I was trying to buy insurance on the marketplace, I realized that there were no insurance options accepted by MD Anderson, a Texas public hospital. I frantically tried to come up with ways to continue to be treated at MD Anderson, but was told by MD Anderson that there are no plans I could possibly buy that they would accept. Fortunately, 2 weeks after the enrollment period ended, Humana offered me a plan that was accepted by MD Anderson, although many other practitioners are not covered. A year later, I find myself in the same position. New cutting-edge treatments are available to me, yet I will not be able to access them. I received the same letter from Humana just a month ago, and once again, there are no providers offering insurance. I'm doing everything I can to stay alive. International friends have offered to marry me. I even had a friend look into adoption. As a citizen of one of the most advanced nations in the world, I should not have to consider marriage as a legitimate option to obtain health insurance. Because Texas has not set up a Medicaid exchange, there are very few options for someone like me with a rare form of cancer that requires highly specialized treatment, and even fewer in the near future. Obamacare does not work in Texas. Because of lack of affordable care, sick Texans like myself are suffering more than they already are. No one should have to accept death because they don't have the right insurance. I cannot tell you how terrifying it is to wake up every day with cancer, especially in a state where you know you might not be able to receive the help that you need, where I have the will to live, but not the opportunity. My choices at this point are to buy health care from the exchange that I cannot use, apply for disability, or to move to another state away from my family of friends and my support system in my entire life. Think of me and other fellow Texans on January 1st who will no longer be able to receive the help that they so desperately need. I would appreciate your positive energy and prayers at this time as I continue to struggle with my health and uncertain future. Thank you.
Niki, thank you for sharing with us. So, this press conference is a beginning. It is a statement that as faith, as part of the faith community, that we want to be a part of the discussion, that we want the state of Texas to know that we believe that people should have health care. We believe that people should be able to live no matter what income they have, that good health care is something that everybody deserves. I want all of you, again, to look at the website abovepoliticstx.org and continue to work with us on this initiative. Thank you.